Hi, my name is Hannah Bednar. I am the director of Texas START, and this is our poster. Both My Health, My Resources, or MHMR of Tarrant County, and Emergence Health Network, or EHN, currently operate Certified Community Behavioral Health Clinics, or CCBHCs. In both agencies, the medical directors for Tarrant and El Paso are the treating physicians at the clinic specializing in treating people duly diagnosed with intellectual and developmental disabilities and mental health diagnoses. Anecdotally, this seems to be a great model because we as START teams see improved outcomes for the people we support who are served in these clinics. Our hypothesis was that those people served in the clinics which specialized in treating psychiatric needs of people with IDD would have better outcomes than those served in generalized community clinics. Our sample size was everyone served in FY19 by Texas START, which was 306 people. About 2/3 were served by MHMR, while 1/3 was served by EHN. There were also roughly 2/3 of people served in community settings and 1/3 served in our START Smart quote-unquote clinics. This chart here at the bottom right is the number of antipsychotics that people were prescribed at intake to START. So as you can see, the vast majority were on 0 or 1 antipsychotic when they were first engaged with START. These are the different services that everyone in every group is considered to have received throughout the time of this data collection. These are the different variables that we considered and looked for differences comparatively. These are the charts for outcomes as they relate to ABCs, psychiatric hospitalization and emergency department use, and then use of antipsychotics in START Smart versus community clinics. And you can look at these more in depth later. In general, the results that we saw was a significant decrease in emergency department and hospitalization use before and after START involvement. We saw that provision of START services was associated with significant improvements on all scales of the ABC. Unfortunately, there was no significant difference between psychiatric service settings across any of these variables. But one of the things we think that could point to is that psychiatric consultation from a START team member is beneficial and offers beneficial results regardless of the setting that they're in. So in a sense, we're making every clinic START Smart. Obviously, further analysis is really important for our program growth and for potential practice implications for Texas START. These are a few of the areas in which we might do some future analysis. So retention and satisfaction across settings, looking at all medications instead of just antipsychotics, and then of course looking at the effect of crisis intervention, so crisis calls, resource center use, and therapeutic coaching.